Welcome to the channel, everyone. Today we are diving into a topic that could very well be life-changing: the serious signs of heart disease that you absolutely cannot afford to ignore. Heart health is one of the most important aspects of overall well-being, and understanding the early warning signs of heart disease can be a true game-changer in preventing severe complications down the road. In this video, we will be uncovering 7 key indicators that may signal underlying heart issues. Whether you're concerned about yourself or a loved one, recognizing these signs is vital for timely intervention. The knowledge you gain here could make a significant difference in prioritizing cardiovascular health, potentially saving a life, maybe even your own. So let's get started. Remember, awareness is the first step towards a healthier heart. Understanding these signs is crucial, and acting on them can lead to better health outcomes. So without further ado, let's dive right into the crucial details of these 7 signs of heart disease. Don't miss it, because this information is too important to overlook. Chest discomfort or pain. Let's start with the first and perhaps most well-known symptoms: chest discomfort or pain. This is a critical symptom that should never be ignored, as it often indicates underlying health issues, particularly those related to the cardiovascular system. Chest discomfort can manifest in various ways, often characterized by a sensation of persistent pressure, squeezing, fullness, or outright pain located in the center or left side of the chest. It may feel like an elephant is sitting on your chest or as though something heavy is pressing down. This discomfort may also radiate to other areas such as the arms, neck, jaw, shoulder, or back. Recognizing these warning signs is crucial because various conditions can contribute to chest pain, including musculoskeletal issues or gastrointestinal problems. However, persistent or severe discomfort should always be promptly evaluated by a healthcare professional. Chest pain can be a warning sign of serious conditions such as heart attack or angina, which necessitates immediate medical attention. Timely intervention is crucial to ensure appropriate care and avoid severe consequences. Ignoring or dismissing persistent chest pain could lead to irreversible damage or even a life-threatening situation. This highlights the importance of seeking medical assistance to accurately diagnose and address the underlying cause of your discomfort. Shortness of breath. Next up is shortness of breath, a concerning symptom characterized by difficulty in breathing. Shortness of breath can manifest with or without accompanying chest discomfort, making it an especially tricky symptom to interpret. It's important to recognize that shortness of breath can be a sign of an underlying health concern that requires prompt attention. This symptom can arise suddenly or gradually, and its severity can vary. Shortness of breath may feel like you can't catch your breath or that you're not getting enough air, which can be quite frightening. Individuals experiencing persistent or severe shortness of breath should seek immediate medical evaluation to determine the root cause and receive the necessary medical intervention. This could be a sign of various conditions, including asthma, pulmonary issues, or indeed heart disease. When shortness of breath occurs in conjunction with chest discomfort, it can be particularly alarming, possibly indicating a more serious condition such as a heart or lung issue. Timely assessment and intervention are crucial to ensure that the best possible outcomes and address any potential heart risk associated with shortness of breath. Ignoring this symptom can lead to worsening conditions and decreased quality of life, so it's imperative to consult a healthcare professional as soon as possible. In addition to these conditions, shortness of breath can result from other factors such as anxiety, allergies, or exposure to environmental pollutants. Anxiety can cause a sensation of breathlessness due to hyperventilation, while allergies or exposure to irritants can lead to inflammation and constriction to the airways. Therefore, if someone experiences persistent or severe shortness of breath, it is essential to seek immediate medical evaluation. This helps determine the root cause and ensures timely intervention. Monitoring and diagnosing the underlying condition might involve tests such as pulmonary function tests, imaging studies, or blood tests. Prompt and accurate diagnosis is crucial to managing the condition effectively and addressing any potential health risks. Unexplained fatigue. Now let's talk about fatigue. Unexplained fatigue is a significant and concerning symptom that extends beyond typical tiredness, impacting your ability to function in daily life. Unlike ordinary fatigue, which is often a temporary and understandable reaction to overexertion or stress, unexplained fatigue persists despite adequate rest and can be debilitating. This profound tiredness can interfere with your ability to carry out daily tasks and negatively affect your quality of life. Unexplained fatigue can be attributed to a variety of underlying health conditions. Cardiovascular issues such as heart failure or coronary artery disease can lead to persistent tiredness because the heart's reduced efficiency means that vital organs and tissues may not receive enough oxygen and nutrients. Autoimmune disorders including lupus or rheumatoid arthritis can cause chronic fatigue as inflammation and immune dysfunction drain your energy. Chronic fatigue syndrome (CFS), characterized by debilitating fatigue that doesn't improve with rest and worsens with physical or mental exertion, can significantly impair daily functioning. Thyroid disorders such as hypothyroidism can result in fatigue due to a slowed metabolism from an underactive thyroid. Anemia, where there's a deficiency of red blood cells to transport oxygen, leads to persistent tiredness and weakness. Mental health conditions like depression and anxiety can also manifest as physical symptoms, including unexplained fatigue. Chronic infections such as mononucleosis or Lyme disease, often present with ongoing fatigue. Sleep disorders including sleep apnea and insomnia prevent restorative sleep, resulting in persistent daytime tiredness. Chronic illnesses such as diabetes or kidney disease place additional strain on the body and contribute to fatigue. Lifestyle factors such as poor diet, lack of exercise, and high stress can exacerbate feelings of fatigue by impacting overall health and energy levels. Persistent fatigue can signal an underlying health concern that requires a thorough evaluation by a healthcare professional. It's essential to consider any other accompanying symptoms that you may be experiencing and provide a comprehensive medical history to aid in an accurate diagnosis. Moreover, it's vital to communicate with your doctor about how this fatigue affects your daily life. This information will assist in diagnosing the root cause, whether it's related to your heart or other potential health issues. The appropriate management of the underlying cause is vital, as fatigue can often be an early warning sign of something more serious. Irregular heartbeat. Moving on to the number 4, an irregular heartbeat. An irregular heartbeat, often characterized by sensations of heart palpitations, a rapid or irregular pulse, fluttering feelings, or even the sense that your heart is skipping a beat. It's a significant cardiac symptom that should not be overlooked. It's crucial to recognize that irregular heartbeats can pose serious health risks, including an increased likelihood of stroke or heart failure. These symptoms can be alarming, especially if they are accompanied by chest discomfort, dizziness, or shortness of breath. Individuals experiencing these symptoms should promptly seek medical evaluation to determine the cause. Monitoring and diagnosing irregular heart rhythms often involve specific medical tests such as electrocardiograms, ECGs, or Holter monitoring. These tests can provide essential insights into our heart's electrical activity, helping healthcare professionals assess your conditions accurately. Irregular heartbeats are not something to be taken lightly. Timely diagnosis and treatment are vital to preventing further complications. It's also essential to understand the potential triggers of irregular heartbeats. Factors such as stress, caffeine intake, alcohol consumptions, and underlying health conditions can contribute to these episodes. Discussing these factors with your healthcare provider can provide a clear picture of your heart health and help develop an appropriate management plan. Dizziness or fainting. Next, we have dizziness or fainting, a symptom that may indicate inadequate blood flow to the brain. This lack of blood flow can raise serious concerns about various underlying health issues, particularly those related to cardiovascular health. Dizziness or fainting episodes can be distressing and disorienting, often leading to a sudden loss of consciousness or feeling lightheadedness. These symptoms can be caused by cardiovascular problems such as irregular heart rhythms, low blood pressure, or other conditions that affect blood flow to the brain. It's crucial to recognize that dizziness or fainting may be warning signs of a potential health crisis. Therefore, prompt medical attention is essential. A comprehensive evaluation, including a thorough medical history and diagnostic test, may be necessary to identify the root cause of these symptoms. If dizziness or fainting is accompanied by other symptoms such as chest pain, an irregular heartbeat, or shortness of breath, It further emphasizes the need for urgent medical assessment. Ignoring these symptoms can increase the risk of falls or complications related to the underlying health condition. This underscores the importance of seeking timely medical care to address and manage the potential causes of dizziness or fainting. Swelling in the legs, ankles, or feet. Let's move on to the sixth sign: swelling in the legs, ankles, or feet. This swelling, medically known as edema, is characterized by fluid retention and is a notable symptom that may indicate an underlying health issue. The accumulation of excess fluid in the lower extremities can be caused by various factors, including cardiovascular conditions, kidney problems, or issues with the lymphatic system. Swelling can occur gradually or suddenly and may be accompanied by other symptoms such as shortness of breath, fatigue, or changes in urination patterns. It's essential to pay attention to persistent or sudden swelling, particularly if it worsens over time or is accompanied by other concerning symptoms. Seeking medical evaluation is crucial to determine the cause of the swelling and initiate appropriate treatment. For instance, conditions such as congestive heart failure can lead to fluid retention, and timely medical intervention can help identify the specific factors contributing to the swelling. Effective treatment strategies might include lifestyle changes, medication, or other interventions to improve overall health and well-being. Ignoring swelling can lead to complications, so it's essential to take the symptoms seriously. If you notice swelling accompanied by shortness of breath or unusual fatigue, seek medical help immediately, as these could indicate worsening heart conditions. Persistent coughing or wheezing. Finally, we reach number 7 on our list: persistent coughing or wheezing. These respiratory symptoms, particularly when accompanied by pink or white blood-tinged phlegm, can signal underlying heart issues such as heart failure. Persistent coughing or wheezing may result from fluid accumulation in the lungs, leading to the respiratory distress. While coughing and wheezing can have various causes, including respiratory infections or asthma, the presence of blood-tinged phlegm may indicate a more serious cardiovascular concern. Seeking prompt medical attention is crucial to evaluate the underlying cause of these symptoms. Heart failure can lead to fluid backup in the lungs, impairing breathing and causing coughing. Diagnostic tests such as chest X-rays or echocardiograms may be necessary to assess heart functions and identify any potential cardiac issues. Persistent coughing or wheezing should not be dismissed, especially if it's accompanied by other symptoms such as shortness of breath or swelling. Early diagnosis and treatments are key to managing heart failure and preventing further complications. Discussing these symptoms with your healthcare provider will allow for a thorough assessment and appropriate management strategies to ensure better outcomes. Thank you for tuning into today's video on the serious signs of heart disease. If you found this video information available, please consider giving it a thumbs up and sharing it with your friends and family. Subscribe to our channel and hit that notification bell so you never miss our future content. We are committed to bring you informative content and impactful health topics that empower you to lead a healthier life. Stay healthy, stay informed, and take care of your heart. See you in the next video.